So when performing a manual muscle test, there's 5 different grades that you'll be looking at. Grade 5 is normal muscle strength, and that would be full range of motion against gravity with max resistance. Grade 4 would be good muscle strength, and that's full range of motion against gravity with moderate resistance. And what normally happens is they can hold against the resistance right away, but then they kind of give out afterwards. Grade 3 muscle strength would be fair strength, and that's full range of motion against gravity, but they can't take any resistance. Grade 2 would be poor muscle strength, and that's full range of motion in a gravity eliminated position. Grade 1 would be trace muscle strength, that's just a visible or palpable contraction with no motion. Grade 0 would be no muscle strength, and that'd be no visible or palpable contraction. So the first step with MMT is to perform the motion passively for the patient so that they understand the movement and to assess their available range of motion. Then you want to see if the patient can perform the motion actively on their own. If they can't perform it actively, then you have to put them into a gravity eliminated position. But if they can perform the motion actively on their own, then you can start to apply resistance to assess their muscle grade. And you also want to remember to stabilize the patient properly when you're applying your resistance. Hey, I'm Andy. This is my patient Molly, and we got Bree doing the camera work over there. Hey Molly, I'm Andy. I'm a student physical therapist assistant. I'll be working with you today. Today we're going to do manual muscle testing, so I'm going to assess your muscle strength in your lower extremities.
Okay.
First we're going to do hip abduction, so if you can lay on your right side.
Okay.
So the motion we're going to be doing is this. Are you able to do that on your own?
No.
Not at all?
Mm-mm.
Okay. I'll have you flip on your back for me. So what I'm going to do is palpate her hip abductor muscles for this. So I'll go ahead and try to bring your leg out. And I can feel the muscle movement contracting, but you're not moving at all, so that'd be a grade 1. Alright, next we're going to do hip external rotation. So I'll have you sit up on the edge of the bed over here. So for external rotation, I'm going to be doing this movement right there, okay?
Okay.
Are you able to do that on your own?
No.
Not at all?
Mm-mm.
Okay. Well, I'm going to have you lay on your back again.
Okay.
So now what I want you to do is rotate your leg outwards like that, okay?
Okay.
Are you able to do that? Good. So she can go through her full range in supine, so that means that that'd be a grade 2 MMT. The next motion we're going to do is knee flexion.
Okay.
If I can have you flip over on your stomach for me. So we're going to be doing knee flexion.
Okay.
And that's this motion right here. Are you able to do that on your own? Good. Now come up to about 90 degrees. And I'm going to pull against you and just try to hold it there, okay?
Okay.
So you weren't able to hold against any resistance, so that's a muscle grade of 3. Okay, next we're doing ankle dorsiflexion. And that is this motion right here, bringing your toes up towards your head.
Okay.
Are you able to do that on your own? Good. Now come up, and I'm going to push against it. Don't let me push you down, okay?
Okay.
So you held against a little bit of resistance, but you gave out towards the end, so that'd be a muscle grade of 4.
Okay.
Okay, next we're doing ankle inversion. And that's this motion right here. Bring your ankle inwards. Are you able to do that on your own? Good. So now come back into inversion. I'm going to try to push you out of it. Don't let me, okay?
Okay.
Good. You held against good resistance there, so that's a muscle grade of 5. All right, so that was MMT for lower extremities, grades 1 through 5. Thanks. Hey, I'm Andy.
I'm Holly. Hi.
Let's start over. Okay.
You're gonna introduce me.
I thought you were introducing us.
Do you want me to introduce you guys? Or do you
Sure. Yeah, you can introduce us.
Okay, is it still going?
Yep.
Okay, start over.
Hey, I'm Andy.